temperature-controlled pressure sore eliminator, also known as the CancerCuddle. Hi, my name is Debbie Teodorescu.
My name is Daniel Gorelick.
My name is Yoon.
My name is Kalmykov.
So our objective today is to discuss a device to reduce the incidence of bed sores in oncologic patients while providing convenient thermal regulation. So this is our enemy here. This is a bed sore. And bed sores are nasty because they're like a bully that hits cancer patients when they're already down. A bed sore is skin breakdown that happens after lots of time in bed, especially, for example, when someone is sick with cancer. And they tend to happen at areas with the greatest amount of contact with a bed, such as the hips, the buttocks, the ankles, and the legs. And the risk of bed sores are increased when there is illness, there's poor nutrition, there is poor circulation, such as when a patient is cold. But not only do they really hurt, as you can tell from the image, they look quite ugly and they smell very bad, but in addition to that, they can get infected, and that opens a whole new can of worms. They result in open wounds that are extremely difficult to heal. They often require surgical intervention. They can result in amputation when the infection spreads to the bone. They can result in long-term disability, and they are responsible for 60,000 deaths a year from the United States alone.
So bed sores are just really prevalent. They're in 19% of cancer patients in hospitals, and they end 33% of patients' lives. 3 million U.S. patients are affected a year, and we have about 60,000 deaths a year from bed sores in the U.S. alone. So currently, the way to approach bed sores is to turn the patients every 1 to 2 hours. If they're sitting, they have to be moved around every 15 minutes or so. And it's especially challenging if the patients are obese, just because it'd be more difficult to get around that. And for home care facilities, caregivers rarely move these patients around enough, and static cushioning does not work very well currently.
So the technology that we're developing is best described as a soft mattress that uses low-flow warmable air that changes the positions of patients. And this is an image of a patient who is quite pale here, who is lying in bed, and they're in a cushion that is deflated on the side that's closest to the screen and inflated on the other side so that it provides some turning, and then that can alternate over time. And you can see as well there is an option for warm or cool air to circulate as well.
And the technology really incorporates this flow so that way we can alternate the height of the sides of the mattress. Again, shifting the patient around more. A soft-looking material to minimize the wetness. And there's also a lot of enhanced comfort, and we're going to try and see if we can reduce the noise of any machine. And more importantly, the air can also be warmed to improve the circulation, which is one of the issues that we had with bed sores. So,
For the future work for this device, we would like to evaluate the optimal flow of the air, optimize air chambers and cell design, optimize the cover and internal materials of the cushioning, test the air versus other fluids like water, hot and cold, assessing the temperature and impact on circulation, and testing in vivo to assess the effectiveness. Pretty much put the patient on and see what happens.
Here are some special acknowledgments off to the CFTCC, to the Epic Center that hosted us, to Lena, who was a wonderful host. She took very good care of us for the past 24 hours, and also Solange, who was a lab technician in Epic and helped us very immensely. Thank you so much.